How to navigate being dairy-free, week 3, lesson 3. Should you have a lactose intolerance, there are a few reasons as to how and why this occurred. Some of you may have been born with this problem where your body does not produce any lactase, making it impossible for the baby to break down the lactose in breast milk. Your mum may have commented that as a baby you had diarrhea in the first few days of your birth, cried a lot, were colicky and possibly were slow to grow and gain weight until you were put on a special bottle formula. This is referred to as primary lactose intolerance. Then there is what is referred to as secondary lactose intolerance. This generally occurs after you have had antibiotics, which can be a temporary thing or it can stay with you. Or it can present itself after you have had gastroenteritis or a parasitic infection, as these two conditions also affect your body's ability to produce large amounts of lactase to digest the lactose in the intestines. But this can also happen naturally, lower levels of lactase, as you get older, or due to your ethnicity, in particular those of African, Asian, Hispanic, and American Indian descent. So what does this do? Because you don't naturally have the correct amount of lactase to break down lactose within the intestines, the sugar sits there causing all sorts of trouble. To begin with, the unwanted lactose will ferment as it interacts with the bacteria that naturally lives there. This is where the gases come from, which can cause bloating, excessive flatulence, cramping, discomfort, and possibly pain. Then what has not been used by the bacteria will stay within the intestines, making its way down to your rectum, and along the way it will draw water into the intestines, causing you to have loose bowel motions or diarrhea. You might also feel that you become more thirsty. This is because you're getting rid of extra water via your intestines. There are some tests that can be done to see if you have this issue, such as hydrogen breath test, stool acidity test for babies, lactose intolerance test, or skin prick test to check for allergy. Milk protein allergy, as mentioned in lesson 1, causes the body to produce antibodies and release other inflammation chemicals to fight what it has considered to be a foreign substance. It will release a lot of inflammatory cytokines and histamine, which you all know causes the allergic reactions that we associate with hay fever. And it can also have a few more life-threatening symptoms, which is why it is very important to take this seriously if you have been diagnosed with having a milk allergy. Thank you and see you next lesson.